Hello everybody, welcome to our channel. My name is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri. And this is my wife.
Hi, I'm Dr. Jennifer Su. I practice conventional gynecology and integrative medicine. Welcome back to our channel. We are like in our comfy clothes because we had a winter storm or whatever they called it, but we got lots of rain and snow, which I love. You don't like it so much.
Not too much, no. But kudos to the Kansas City Chiefs. They're advanced to the AFC Divisional Championship.
And the Titans had a good game too.
Yep, they're going to be facing the Titans next week.
Ooh. Okay, today is about brain fog. If you've never joined us before, we love integrative medicine and approaching all medical topics from an integrative medicine perspective. Please subscribe, give our video a thumbs up, we appreciate it, and always hit the notification bell down there so you know when we've uploaded our next video. We upload 2 videos a week. Midweek, we always like to check in with you guys with like a short, focused topic. So today is brain fog, and I think all of us have had some brain fog at some point. Some of us just because we're distracted, but some of it's a real problem, and it can be embarrassing. But what we're going to do is we're going to talk about practical things that you can do to help yourself, and then we're going to go into maybe some things that you can talk to your doctor about, and that way you can get better. So, first off, brain fog is basically where you really cannot think of what you were going to say, and it's embarrassing. You might be a CEO, you might be trying to run a business meeting, and you just can't, you're not sharp. It's kind of foggy, there's no clarity. Basically, we want to make sure that, number one, you're not distracted. Like a lot of us have a lot of things going on. There's tons of stuff about brain fog on YouTube. You can check on those channels. I really liked this one guy on Better Ideas. He said, write down the things you need to do, or if you have made an appointment with a friend, don't just keep saying, what he says in the video is like, don't keep saying, I'm gonna have a lunch date with Michael on Sundays at 2. I'm gonna have a lunch date with Michael. He says, just write it down. It's out of your brain and it's on a piece. Like we have our smartphones, we write down everything on our smartphone with an alarm so that you can just enter it in your phone or write it down in a big planner. Done. It's right there.
Yep.
It's pretty cool. And then sleep. You want to make sure you're getting at least 7 to 9 hours of sleep every night. If you have done pretty much all these things, like trying to clear your mind as much as possible, meditate, relax, exercise. Exercise is great for mental clarity. If you've done those things and it's still no better, you might want to talk to your doctor because they'll do basic tests.
Yep. And you know, the other thing too is that you might even be being told by your family members that you are actually starting to kind of lose concentration and you're repeating things, or things just don't seem to be coming as quickly to you as they did before. So pay attention to that as well, and just pay attention to what your family is telling you.
The doctor will most likely draw blood tests. They might even do a screening panel for mild cognitive impairment. If your blood tests are run, they might check for thyroid disorder, they might check for menopause, they might check for hormonal disorders like low testosterone in males. They also might check for vitamin D as well. So there's a variety of different things that can cause brain fog, and your doctor will be able to screen you for those things. And in terms of stress, there is a syndrome, and it's not recognized by traditional medical doctors. And in fact, if you Google adrenal fatigue syndrome or adrenal burnout syndrome, the American, I forget which organization of traditional medicine will not recognize it at all. It thinks it's actually dangerous because we think that it's a real thing, but it is. It's a syndrome. It's not a disease. Adrenal burnout syndrome, it used to be called adrenal fatigue syndrome, is a condition that can cause brain fog. It's reversible, it's treatable, it's not a disease. So if we're not talking about Addison's disease, like adrenal, it's not adrenal insufficiency, we're talking about adrenal fatigue syndrome. And we'll link our video, which we've done right there, so you can refresh yourselves about that. What else can cause it? So if you've done all that and you're seeing your doctor, you're pretty much, let's say the worst case scenario is they say you have mild cognitive impairment. Ginkgo is a supplement that helps early dementia. but not later dementia. And also, there is a supplement called whole coffee fruit extract at 300 milligrams a day that actually is proven to increase brain-derived neurotrophic factor. So it's actually increasing your brain tissue.
Yeah. And when you look at treatment for brain fog, it really focuses on what actually caused it. Now, like what Dr. Su mentioned, there are many things that can cause brain fog, and some of the other ones that I see in my practice are people that have chronic migraines, chronic depression, chronic pain in of itself can cause a type of brain fog where patients have just become so stressed and preoccupied with their condition that they really lose sight of things that they were supposed to remember and their plans and so on, and just their life is just kind of inwardly focused versus outwardly focused. So just be aware of that too. And once you treat a lot of these things, the brain fog and those symptoms of it will actually resolve with time.
Mm-hmm. Hopefully this was helpful. Our midweek check-in this week is on a great vitamin, and it is electrolyte, and it is
magnesium.
I bet you were thinking magnesium.
Yeah.
So we'll see you between Tuesday and Wednesday, or Wednesday, Thursday, depending on when we have time to upload the video. And thank you again for all your support. Please comment below what you would like to listen to, and we will do our best to cover it. Somebody asked for brain fog. We really appreciate that. And we'll see you again in our next video.
So long, everybody.